Hi everyone, my name is Liana Laughlin, and I know it's been a while since you've seen my face because I haven't done any procedures in a long time because of the pandemic. But now, I am finally back to do a new procedure. The last procedures that I have done is the Ulthera for slimming down my face, the Aller injection for slimming down my nose, and lastly, the Ultraformer for slimming down my tummy. Because as you guys know, I like to participate in pageantry and in modeling. And to face a camera, I need to be picture perfect in terms of my body and in my face. And to get that picture perfect selfie, I need to have a small nose along with a small face. So I think it has been around a year already since I did the Ulthera. But as you can see, until this day, the effects are still there. And she has also noticed me getting more acne. And I think this comes from the oiliness and the mask. You know, like during this pandemic, we'll have to wear masks and all the dirt and oil is just stuck in our face. So she mentioned to me how important it is to keep our face exfoliated, especially during the times we need to wear masks. And that is it, guys. Don't forget to click the subscribe button and turn on the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. They say that the eyes are the window to your soul. And also, our eyes are the powerful vehicle for non-verbal communication. So our eyes can speak. And so in today's episode, we have a topic called Reveal Your Eye Beauty. With us, we have Liana. Welcome, Liana. Okay, so if you recall, Liana was a guest in our previous episodes, and we have done procedures like Ulthera, okay, and also some body treatments, right, Liana? And also the masseter reduction. Okay, so how's the experience after all those treatments?
Well, definitely it has made me more confident, not only in my face, but also in my body. And as a beauty queen, it's important to look picture perfect in any angle, and you helped me achieve that.
Thank you. So especially nowadays, it's very important to really look good in those camera screens. And I think there's gonna be an event, right, Liana? That you're gonna be doing like a virtual pageant. Wow, nowadays we can do that. Like I did also a virtual conference few days ago. Okay, so actually I saw Liana like a few weeks ago or a few days ago, and I noticed that her under eye were sunken, and I asked Liana, is she sleeping early or like late?
Yeah.
Napupuyat mga kasi. Ako kasi I too napupuyat due to watching movies, Netflix. Okay. And another thing is also a genetic factor. Some people really, they have this deep set eyes, okay? So some like a race, like you mentioned, Arabic, or the others, Indian, or some other race, they have this really deep set eyes. So the genetic factor is also one thing to consider when we see some people with this hollow under eye. And then the lifestyle, yeah, so we've mentioned like if you don't sleep early, so or the lack of sleep, okay, or stress also, or lack of hydration, or the like me, the aging, because Liana is just 18 years old, okay? So on my part also, the aging is a factor to consider when there are problems or concerns around the eye or under eye area. So like the thinning of the skin, the sagging of the skin, the loss of collagen, and so leading into this volume loss under the eye. Okay, so those are factors or etiologies of having this hollow or sunken under eye. Okay, and so once you have this hollowness there, it creates that darkening effect. So some would say it's like there's this pigmentation, or the others were saying panda eye or raccoon eye. Okay, so you have this darkening of the skin under the eye. So with Liana, because I was telling Liana, this part here, you see, you notice it's already like there's this groove here. So the part here is called the tear trough region here, and then when we go on the lateral aspect, there's also this hollowness here. So it's the entire infraorbital rim. There's this dent or this hollowness. Okay, and she's very young. Of course, we have to think of procedures that will be very safe, and we don't want anything that's very aggressive and invasive. So we just wanted to do like an enhancement in a natural way. Okay, and another thing, actually, I was looking at Liana a while ago and assessing her skin. Of course, she's still a teenager, and teenagers still get this zits or some of those comedones. So comedones on the forehead, the beginning of the acne formation. So we wanted to do something to prevent the progression into papular acne. So they're just tiny ones here, tiny bumps on the forehead. But we wanted also to do something for her skin. And actually, we want to introduce to you a new treatment. Later on, we'll tell you what that treatment is. Okay, I'm so excited, Liana. All right. Before we show them the actual procedure, do you have any questions or concerns regarding this like topic of ours, like the under eye rejuvenation? Do you have anything in mind?
I was thinking if it was gonna hurt because you said it was like fillers, so it's gonna be like injection.
Right. Okay, so yeah, I've mentioned to Liana already that we're gonna use a light soft filler for the under eye. And of course, if we do dermal fillers, there will be injection, okay? But it's just gonna be a single entry point. Of course, we numb the skin before we do anything. Before we inject the skin, we have to apply topical numbing cream. Okay, it's gonna be tolerable. Remember when we were doing some injections here, right? And some like injections here, right? So we're just gonna use tiny needle. Okay. Most of us are asking, will the procedure be painful? So I'm definitely sure that it is gonna be a very tolerable treatment. Okay, any other question? No. Okay, thanks, Liana. So, we're gonna show you the actual procedure when CSA Medical Aesthetics return. And we're back, mga ka-CSA. So, we are now at the part of showing you the actual procedure for the under eye rejuvenation of Liana. So, Liana, are you ready? Okay.
Ready.
Okay, so the first step of the procedure is to do cleansing of the skin area and then apply a topical numbing cream. Okay, then like after half an hour, then you can start the procedure, and then you can make a marking here from the tear trough region, a diagonal line, and then something that will intersect with the vertical line from the lateral canthus to this area here, and the outer horizontal line, and then that's your entry point. Okay, so I have already numbed the area. Okay, so we'll make an entry point, and I have here like a gauge 23 needle. It's just a tiny needle. I'll pinch the skin a little bit, and just I'm gonna make an entry point. Puncture lang, Liana. There you go. And then I have my Belotera Soft for my under eye region with a cannula here. So you have to insert the cannula into that entry point. and then glide it towards your tear trap region. Okay, so I'm in a subdermal plane, and then start to inject micro aliquot of your dermal filler. Okay, so how do you feel, Liana?
It's my pinch.
Okay, and then so let's take it out first. Let's sponge the area, then insert again, and you can have it in a vertical line here. I need to also fill in this lateral portion. Okay, just glide towards the lateral canthus. So pressure lang, Liana. Inhale, exhale, and then you can fill in again with an aliquot of your Belotero soft. Okay, so far so good. The good thing with this filler, it has lidocaine, so it gives that comfort, and also it will help in further numbing the under eye region. So I'm gonna inject a little bit here in the middle to fill that in. Then I can go back to the tear trap again to fill in that sunken area. Okay, it's towards the middle canthus of the right eye. So we're working on the right eye region. So Liana is just okay, she's relaxed. Okay, there you go. So it's just half cc, half syringe of our Belotero soft. So we have shown you the treated area and the untreated area, so you can already visualize an instant result. Okay, so let's proceed to the left side. Again, same technique. So make a diagonal line from the tear trap, and then the one that intersects your vertical line from lateral canthus and the horizontal line from the ala of the nose, and that's your entry point. So pinching the skin and a tiny puncture. Inhale, exhale, Liana. Sorry. Okay, there you go. And so I still have my half syringe of my Belotero soft. Okay, sponge please. So now I'm gonna insert this cannula here. Okay, let's just wait for the bleeding to stop a bit. So that's expected because we did a puncturing. There you go. And then just glide towards the medial canthus of the left eye, and it's just gonna be a gentle gliding, and then you push an aliquot of your Belotero soft in the tear trap region. So again, the plane, subdermal plane. Okay, and then after that, you can already also correct the one on the inferior to the lateral canthus. Okay, there's just some bleeding here. Injecting towards the lateral canthus because there's also hollowness in that region. So we have to push this cannula towards our entry point. Okay, sponge, and then it's gonna be, yeah, this side a little bit of a bleeding, and then towards our lateral canthus. So we wanted to correct also that hollowness in the lateral portion, and then inject or push an aliquot. So when you push it, it's just a slow restore the volume, fill in that hollowness there. So this one also reduces the darkening under the eye region. So for those with concerns of dark circles, this is your remedy also. And just drink a lot of water so that it's still gonna plump up. So we have done the under eye dermal filler for Liana. Okay, I can already see an instant result. So there's this instant elevation of what was sunken. Okay, so when you injected the filler, it filled in the hollow part, and then it pushed that skin upwards, so giving that balance between the lower eyelid and the upper cheek region. So yung lid cheek junction niya nag-even, it smoothened out. So there you go. So As you can see in the after photo, you can already appreciate an instant result. And the good thing with this under eye filler, it can also correct the dark circles. So just drink a lot of water, it's still gonna improve over time. And again, we use a soft filler with good cohesivity, with good tissue integration. It's just gonna blend in within the tissues. And on top of our under eye dermal filler, we're gonna add another treatment for Liana. This is for her skincare. Okay, she's still a teenager. We want an exfoliation treatment that will still be very mild, something gentle for her skin. So we wanted something like, we use a laser, but it's a non-ablative one. It's just gonna be sloughing off dead cell layers, making her skin smoother, softer, without pores, and also preventing our acne or pimple formation, right? Yes, I'm so excited. So we'll introduce to you our last MD. This is the one that we're gonna use for the so-called silk peel treatment for Liana. Okay, the procedure is just to start with the cleansing of the skin, okay? And then after that, of course, before doing this procedure, we tell our clients not to wear any makeup or thick foundation. We just remove the sunblock. So we cleanse the entire skin. Okay, actually no need for topical numbing cream. Yeah, like I did this too. I just did it on myself. So we have our last MD thulium laser here. Okay, so it has the handpiece here. Okay, it's just a simple technique. So we have here some of the parameters here, and then we just click on the ready button, and then there's a foot pedal there. You just need this. And then again, this is with the thulium kind of a laser. There's this like orange colored thing here. Okay, orange colored thing there. Okay, we need to cover the eye of Liana. We just use this blue colored goggle. Okay, yeah, cover lang natin eyes, Liana. Okay, this is a quick procedure only. Okay, it's a lunchtime treatment. You can do it on your coffee break or lunch break. Okay, just want to make your skin become silky. That's why we call it silky peel or silk peel. So we're just gonna apply it directly onto the chin. Okay, so you can start on the chin region here and then just glide like that. Okay, and then on the upper area like that. Okay, and then this part here on the lower third of her face, just do the gliding like that. So Liana, what do you feel?
Tingling sensation.
Okay, it's just tingling. Take note, we did not put any topical cream. Okay, so it's just this gliding the laser beam onto the skin like that. So nagro-roll lang yung kanyang tip area. So you'll notice some redness, minimal redness or erythema. Ayan, meron ng, that's normal, that's natural. In a little while, it's gonna clear also. So we can also do like a vertical approach like this, and second stroke like that, and then another one here. So this is an easy procedure lang. O, diba? Actually, you can even do it yourself. I can do it on my own face. It's just that this machine is, like, I could say it's a heavy duty machine. Okay? Hindi siya parang portable type of a machine. Okay, I'm gonna proceed to the temple region. Oh, simple lang, right?
Yes.
So are you okay, Liana? Okay. So it has a thulium laser. It's actually making the skin become, it has some tightening effect also. So for those who have some tiny, or should I say, fine lines. So they can also
for
do,
the large pores of that.
yes, also for pore reduction too. Okay. Kasi we wanted to like reduce the size of the pores to also prevent acne or pimple formation.
Yes.
So this is what we want to do for Liana. And those with some shallow face scars or pimple scars or pimple marks, they can do this.
Yes.
Okay. So I did it on the other side, right side here. So let's proceed to the left side. Same thing, same stroke. So like I do a vertical, rather a horizontal stroke like this. So you can do 2 to 3 passes. Okay. But with Liana, we already have seen redness.
Yes, the erythema.
Right. So again, this kind of laser is very beneficial for those with widely open pores, some shallow scars, those who wanted to do treatment of fine lines or wrinkles, for those who wanted to have silk skin, smoother skin, finer skin. This is a remedy. So I call this treatment silk peel. Okay, so I'll proceed to the chin region. Okay, so Liana easily turns red, right, Liana? Because it's in her genes. So heredity plays a role, right? So what line again, or like do you have this family line of European?
German, right?
Irish.
Irish.
Yeah, wow. When is St. Patrick's Day? The Irish. Okay, so this is a quick procedure. So actually after the procedure, we just do ice compress or also cryotherapy to directly treat the erythema or the redness. You can even apply topical serums like vitamin C, hyaluronic, or any vitamin A for the skin. Any skin nutrients will be very beneficial after doing this kind of our silk peel. So we have done the last MD silk peel for Liana, and we also did the cryotherapy to reduce the redness or erythema. We'll show the result to Liana when CSA Medical Aesthetics returns. And we're back. So let's show the result to Liana. Let's have the mirror.
Here's our mirror.
Look at the under eye first.
Yes.
Instant, right? You
Yeah.
noticed? Because a while ago, it was really so sunken. It was really hollow under the eye region.
No need for makeup or concealer anymore. It's like
Exactly.
naturally alive, you know.
Right, yeah. I like that. The eyes look naturally alive, or it is immortalizing the eyes. Not only alive, but immortalized.
Nabuhayan. Parang ganun.
So you look so refreshed.
Yeah.
Because you know the tired, the
Tired,
eyes. If we are so tired, they really will be obvious, right?
Yes, it's very
So,
reflective kasi, no?
Exactly. So like for people, dark circle or sunken, people will say, "Oh, you're so tired. You look haggard. You don't look fresh."
Like a zombie.
Na-stress ata sa Liana, Doc.
Yeah. But right now, with the help of our dermal filler, we were
Yes.
able to correct that problem. So like if you have a meeting or like any event that you're gonna do, and then people look into your eyes, "Oh, Liana, you look so refreshed," right? Yeah. So
How's your
revealing-
feeling naman on the Lace MD?
Yeah. Next.
Well, there's definitely like a warm, tingling sensation, but the procedure itself is very relaxing.
Yes. Okay, so with the last MD silk peel, take note, we have those laser beams rolling onto the skin, and it's like also creating like a tiny micro channels only. Okay, and then the reaction of the skin is to also induce some tissue repair and collagen formation. So it's also boosting our skin's natural regenerative system.
Wow.
So it's also good for rejuvenation or anti-aging also.
Reduction
And
of large pores.
Exactly. Also the fine lines.
Yes.
Okay. And also some pimple blemishes. So it's also good treatment for those people who don't want those kinds of lasers with this after effect of marks, laser grid marks, obvious grid marks. So this is a better one. It's a milder or more gentle type of non-ablative laser.
Yes.
Okay.
Also, pinagmamalaki ng Lace MD, Doc, yung non-ablative laser. Tulyo
Correct.
niya. Yun.
It's a thulium. So it's expected after the laser, there's gonna be some redness, minimal redness actually. And considering Liana, she's a foreigner, she has this Irish
Yes. Irish blood.
So they tend to become red. Ako kasi, I don't tend to become red. Asian skin or brown skin, okay? But in a little while, the redness will also go away. It's just gonna be a temporary. When I did this, like half an hour only, and then the redness was gone.
Apa.
So you can apply some serums. We did a while ago applied hyaluronic. You can even apply vitamin C serum or vitamin A serum to
Yes.
combine with the silk peel. So it's a very good treatment.
Oh,
Okay, any message to our televiewers, Liana?
Well, if you guys have any problem with like skin texture or acne, especially if you're a teenager like me who gets oily skin all the time, CSA is the right answer for you.
Thank you. Doctor, anything to share more?
If you want to avail the CSA Lace-Up, the silk peel, you just go here to CSA Infinity and book an appointment, no? And then safety protocols for the COVID.
Yeah. If you have any more questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Derm Centre, Instagram CSA Derm Centre, and also we have a new website. It's the www.csaderm.com. Okay, www.csaderm.com. Okay, so our clinic is located here at the Infinity Shop, Francisco G. Nepomuceno Avenue, Pulong Maragol, Angeles City. Contact number 0933-860-9190 or 0917-504-4268. So please do watch our other YouTube videos. Just type Contessa Salvador. Okay, thank you so much. Thanks, Liana. Thanks, Dr. Nia. Thanks to all of you. God bless you. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.